I'm Emma Smizer. This is my head to toe assessment for my final. This is my mom, Amy. She's going to be my patient for the night. So, knocking on the door, entering patient's room, and closing the door, providing for patient privacy. Hi, Amy. I'm Emma. I'm going to be your nurse for this evening. Can I have your last name and date of birth, please?
Smizer 62961.
Great. Verifying patient identity. I'm washing my hands and donning my gloves, providing for patient for hand hygiene. Amy, we're going to be doing a head-to-toe assessment today. Can I first start off by asking you if you're having any pain or discomfort?
No.
No? Okay. Do you have to use the restroom before we get started?
No, thank you.
Great. Okay. And then I have a few more questions. Could you please tell me what today's date is?
Tuesday, November 27th.
Great. And can you please tell me where you are?
Home.
Okay. And who's the president?
Trump.
Great. So patient is conscious. She is awake, alert, and oriented times 4. Person, place, time, and event. I'm now going to assess the patient's vital signs to make sure she's stable enough to continue with the head-to-toe assessment. So I'm going to assess her blood pressure, pulse, temperature, respiration rate, and pulse oximetry rate, and I've already assessed her pain as she denied any before. I'm now going to move on to palpating the head as I've already been inspecting it. I noted no gross anomalies. Head appears to be and feels normal cephalic in shape. Hair is full and even throughout. I've inspected the face, so I'm going to move on to palpating that as well. No gross anomalies found. Palpating the sinuses. Amy, did you have any pain or discomfort?
No.
Good. I'm going to move on to the cranial nerve assessment. I'm going to start off by assessing the patient's first and second cranial nerves. That's the olfactory and the optic. So for the olfactory test, I'm going to ask the patient to close her eyes and plug one nostril, please. And can you tell me what the scent is? Alcohol. Okay. And please plug the other nostril. Great. And can you tell me what the scent is?
Coffee.
All right, thank you. Go ahead and open your eyes. Okay. Patient is wearing readers, so I'm going to allow her to use those while doing this test. I'm going to hold this 14 inches away from your face. Can you please read the most visible line with one eye covered? Thank you.
937826.
Great. Okay. And uncover and cover the other eye. Great. And read the most visible line.
937826.
Good. Okay. And both eyes, please.
428739.
Good. So patient's vision in both eyes individually is 20/25. Together she measured at a 20/20. Again, she's wearing her glasses per her norm. I'm next going to be testing the patient's third, fourth, and sixth cranial nerves. That's going to be her oculomotor, trochlear, and abducens. So for this, I'm going to ask the patient to please follow the movements of my pen. Good. All right. Can you please lift your glasses on top of your head? Thank you. Okay, please remain looking forward, okay? Good. Patient's pupils are equal, round, reactive to light, and accommodation. Let's see here. And they're measuring, at a diameter of about 3 millimeters. Next, I'm going to be testing the patient's 5th, 7th, 8th, and 11th cranial nerves. So I'm going to ask the patient to smile and frown and clench your teeth. Puff out your cheeks, please. Can you raise your eyebrows and wrinkle your forehead? Okay, good. Open your eyes wide. Okay, and close your eyes. Good. All right. I'm now going to whisper into your ear. Please repeat after me.
Apple.
Good.
Orange.
Good. And finally, I'm going to ask you to shrug your shoulders. Good. So that was testing, again, the patient's 5th, 7th, 8th, and 11th cranial nerves. That's going to be her trigeminal, her facial, her cochlear, and her accessory. And finally, I'm going to move on to testing the patient's 9th, 10th, and 12th cranial nerves. It's going to be her glossopharyngeal, her vagus, and her hypoglossal. So for this, I'm going to ask the patient to stick out her tongue and move it from side to side. Good. And can you tilt your head back and swallow, please? Good. Please open your mouth and say ah.
Ah.
Good. And press against the tongue depressor. Good. And please open your mouth wide. Thank you. All right. So patient was able to swallow without difficulty, move her tongue from side to side, say ah with no difficulty. Her uvula remained midline. I was also able to inspect the oral cavity while doing that test, and her oral mucosa was pink and intact. I'm now going to move on with the rest of the head to toe assessment, as that had concluded my cranial nerve assessment. So I'm going to inspect the patient's neck, again, for any gross anomalies. I would like to note that the patient's overall skin appears to be intact, and she's clean, comfortable, and well-nourished. Her skin and her neck specifically is warm, dry, and color is appropriate for ethnicity. I'm inspecting the patient's lymph nodes. Any swelling or tenderness?
No.
Okay, good. I'm now moving on and inspecting the patient's carotid arteries. I'm going to auscultate and check for any abnormal sounds such as bruits. Okay, Amy, please go ahead and inhale and hold it. Okay, good. And again. Good. All right, release. Okay, great. I'm now going to palpate the carotid pulses. Good. And good, okay. Both carotid pulses are present bilaterally and equal and measuring at a strength of 2+. Now I'm inspecting the patient's upper extremities. So I'm checking for any signs of trauma, any gross anomalies, asking the patient if there's any pain or tenderness here. Noting my brachial pulses and checking the radial pulses bilaterally. They are present equal bilaterally and measuring at a strength of 2+. I'm now going to do my final circulation check, and that would be capillary refill. For that, cap refill is present bilaterally and is less than 2 seconds. Less than 3 seconds. Now I'm going to move on to a range of motion check. So Amy, I'm going to be moving your arms. Please let me guide them, okay? Okay, good. And roll your wrists for me. Great. Okay, and roll your wrists, please. Good. Please squeeze my fingers. Good. Pull. Good, and push. Good. Patient's range of motion is a measurement of 5. Strength is present and appropriate for physical condition and patient's age. I'm now going to ask the patient to move her head from side to side. Good. Look left, look right, and tilt your head back and forth. Good. Patient's range of motion is also present in her head. Okay. I'm now going to assess the patient's chest. Upon inspection, I see no gross anomalies. Assessing for symmetry. Skin turgor is brisk. Patient is well hydrated. I'm now going to auscultate the patient's heart sounds in 5 different points. Normally I would do this with the diaphragm part of the stethoscope and followed up by the bell, but for intents of the test, I'm going to just do it with the diaphragm. First, assessing the patient's aortic sounds. That's going to be the second intercostal space, right sternal border. Moving across the sternum to the left sternal border, second intercostal space, is the pulmonic valve. Moving down to the third intercostal space, left sternal border, is Erb's point. And fourth intercostal space, left sternal border, is the tricuspid valve. And then finally, I'm going to lift your breast. Fifth intercostal space, mid-clavicular, is going to be the mitral valve. And that is the site where I would assess the patient's apical pulse, and for that I would count the pulse for your full 60 seconds. That is also known as the point of maximum impulse. I'd like to note that S1 and S2 sounds were normal and present in all 5 locations. Okay, I'm now going to assess the patient's lung sounds. I'm going to be assessing 8 different locations anteriorly and 10 posteriorly. So normally I would have the patient inhale and exhale once at each location, as that is counted as 1 breath. But for intents of the exam, I'm just going to ask the patient to breathe normally so she doesn't go into hyperventilation. Okay, and please turn to your right. I'm now assessing 10 locations on the patient's posterior. Alright, lung sounds were clear and present in all fields. I'd like to note that obviously on the posterior of the patient, I'm making sure to not go below the rib cage and hit the flank of her back, because that would not be a proper location to hear the lung sounds. Amy, go ahead and stand for me, please. I'm now going to be doing an abdominal assessment, so if you wouldn't mind laying back, please. And for this assessment, I'm going to be doing an inspection, also taking bowel sounds, percussing, and then I will be palpating, okay? My general inspection of the patient's abdomen is that it is free of any gross anomalies. I see no signs of trauma. Skin is warm to the touch, color is appropriate for ethnicity, and skin is dry. I'm now listening for bowel sounds in all 4 quadrants, making sure to listen across each quadrant. Good. Normal bowel sounds are present. They are active. They are not hypo, hyper. They're just right where we want them. I'm now going to percuss the patient's abdomen. 3 different locations in all 4 quadrants. Good. So we're getting those tympanic sounds in the upper quadrants and the dull sounds in the lower quadrants, which is also good. That's what we want. Finally, I'm going to percuss the patient's abdomen. So I'm checking for any distension or swelling of the liver or any swelling of the patient's bladder, to which I did not note any. Did you have any pain or tenderness?
No, none.
Okay, great. Moving forward, I would assess the patient's femoral pulses and her genitalia. I'd check for things, rashes, any discharge, any catheters, tubing, anything that would be out of, what's to be expected. At this point in time, I'm going to ask the patient to return to the sitting position for a lower extremity inspection. Overall, I don't see any signs of trauma, any gross anomalies. Patient's skin is warm to the touch, dry, and color is appropriate for ethnicity. I'm going to do a quick palpation to see if there's any pain or tenderness of the patient that maybe wasn't noted before. I'm going to inspect the patient's popliteal pulses bilaterally, her posterior tibialis pulses bilaterally, and her dorsalis pedis pulses bilaterally, which are going to be on top of the foot. I'm now going to, following my pulse exam, I'd like to note that all 6 pulses were present, equal bilaterally, and at a strength of 2+. Okay, I'm going to perform a range of motion test now, Amy, so if you'd like to sit back, let me do the work for you, okay? Good. Bend. Good. Roll your ankle for me. Good. Straighten your leg, please. Good. Good. Bend. And roll your ankle, please. Good. Please place your foot on my knee. Okay. And relax it. Push against my hand. Good. And pull. Good. Okay. And push. And pull. Good. Finally, I'm going to ask you to stand, please. Okay. And come this way. Great. And turn around, please, and take a few steps that way. and come back. Good, and remain there. So at this point in time, I'm assessing the patient's ambulation, checking for any signs of imbalance. I also made a note of the patient's spine. It appears to be midline, which is good. Finally, I'm going to ask the patient to stand with her feet together and hands at your sides, please. And go ahead and close your eyes for me. This is called the Romberg test. This is, again, testing for patient balance. I'm going to be assessing for 20 seconds to see if there's any swaying. You can go ahead and discontinue the test and have a seat, Amy. Thank you. At this point in time, my head-to-toe assessment is completed. I'm going to be sure to document the patient's level of consciousness, mentality, note any abnormal findings in any of the systems. That would include her GI tract, respiratory tract, neuro, cardiovascular, circulatory systems, range of motion, balance, and ambulation. I'm going to make sure I leave the patient with her personal belongings and the nurse call light at bedside and within reach. And I'm going to place the bed in the lowest position possible to ensure patient safety. Thank you.